People think all infections are basically the same. You feel sick, you take something, and you move on. But here's the truth. Understanding the type of infection you have can be the difference between getting better fast or making things worse without even realizing it. Think about it. You've probably had a sore throat, a cough, maybe a skin rash, or even a stomach issue at some point. They all feel unpleasant, but they don't all come from the same source. And that's where things get interesting. Infections are generally grouped into 4 main types: bacterial, viral, fungal, and parasitic. Each one behaves differently, spreads differently, and most importantly, responds to treatment differently. Let's break this down in a way that actually sticks. First, bacterial infections. These are caused by bacteria, tiny living organisms that are everywhere around us. Some are harmless, even helpful, but others can cause disease. A common example is a bacterial throat infection. Another is a urinary tract infection. What makes bacteria unique is that they can multiply on their own. Once they get into your body, they don't need much help to grow. Here's where it becomes practical. Bacterial infections are usually treated with antibiotics. And when used correctly, antibiotics can be very effective. But here's the part most people get wrong. Antibiotics only work on bacteria, not viruses, not fungi, not parasites. And misusing antibiotics, that can lead to resistance, which means the next time you really need them, they might not work. Now let's talk about viral infections. These are probably the most common ones you've experienced. Think of the common cold, the flu, or even some types of coughs and fevers. Viruses are different from bacteria in one major way. They can't survive or reproduce on their own. They need to invade your body's cells and use them to multiply. That's why viral infections often spread quickly. And it's also why antibiotics don't work on them. Taking antibiotics for a viral infection is like trying to fix a broken phone with a house key. It just doesn't match the problem. So what helps with viral infections? In many cases, your body does the work. Rest, hydration, and time are often the main treatment, though in some cases, antiviral medications may be used. Here's where it gets interesting. Many people confuse bacterial and viral infections because the symptoms can look very similar. Fever, fatigue, pain, they overlap. But the cause underneath is completely different, and that difference matters. Now, fungal infections. These don't get talked about as much, but they're more common than people think. Fungi are organisms like yeast and mold. They thrive in warm, moist environments, which is why fungal infections often show up on the skin in areas like between the toes, underarms, or even the scalp. A classic example is athlete's foot. Another is yeast infections. Fungal infections tend to develop more slowly compared to bacterial or viral infections, and instead of antibiotics, they require antifungal treatments. Here's something a lot of people overlook. Poor hygiene isn't always the cause. Sometimes it's just the environment. Sweat, tight clothing, or even a weakened immune system can create the perfect conditions. Now let's move to parasitic infections. These are a bit different because they involve organisms that live in or on a host. Basically, they rely on your body to survive. Parasites can enter the body through contaminated food, water, insect bites, or poor sanitation. Examples include malaria, intestinal worms, and some skin infestations. What makes parasites tricky is that they can be more complex. Some live in the bloodstream, others in the digestive system, and their life cycles can involve multiple stages. Treatment depends on the specific parasite, often requiring targeted medications. Now let's bring it all together, because this is where clarity really matters. Bacterial infections caused by bacteria, treated with antibiotics. Viral infections caused by viruses, usually managed by the immune system, not antibiotics. Fungal infections caused by fungi, treated with antifungal medications. Parasitic infections caused by parasites, treated with specific antiparasitic drugs. 4 different causes, 4 different approaches. But here's the part most people don't think about. Misunderstanding these differences can delay recovery or even make things worse. Imagine treating a viral infection with antibiotics. Not only does it not help, but it also contributes to antibiotic resistance. Or ignoring a fungal infection, thinking it will go away on its own when it actually needs targeted treatment. This is why accurate diagnosis matters. Now, when should you actually be concerned? If symptoms last longer than expected, keep getting worse, or come with high fever, severe pain, or unusual signs, Don't guess. Get medical advice, because while many infections are mild and manageable, some can become serious if left untreated. Here's a simple way to remember everything we've talked about. Think of infections like 4 different types of intruders. Bacteria are like independent invaders. They come in and multiply on their own. Viruses are hijackers. They take over your cells to survive. Fungi are opportunists. They grow where the environment allows them. Parasites are dependents. They live off you directly. Same outcome, you feel sick, but completely different strategies behind the scenes. And once you understand that, you start making better decisions about treatment, about prevention, about when to act and when to wait. Because the real goal isn't just to treat infections, it's to understand them. And when you understand them, you're no longer reacting blindly. You're responding with clarity. So next time you feel something off, a cough, a rash, a fever, pause for a second and think. Not all infections are created equal, and that one insight alone could change how fast and how well you recover.